Hello, everyone, and welcome to my webinar on allergies and histamine. My name is Sarah Karolidis, and I'm thrilled to have you all here today. We will explore the fascinating world of allergies, understand the role of histamine, and discuss some management strategies. So let's dive right in. What are allergies, and why do we get them? Allergies are exaggerated immune responses to substances that are generally not harmful. These substances, known as allergens, can include pollen, dust mites, animal dander, certain foods, and insect stings. An allergy occurs when your immune system mistakes a harmless substance for a dangerous one. And this overreaction can lead to symptoms ranging from mild to severe. These are some of the most common allergens. Exposure to any of these can trigger allergic reactions in susceptible individuals. And those reactions play a big role. Worldwide, allergic rhinitis, that's hay fever, affects between 10 and 30% of the population. Sensitization, which means IgE antibodies to foreign proteins in the environment, is present in up to 40% of the overall population. And in 2023, it was estimated that 44% of adults and 50% of children also in the UK have one or more allergic disorders. The UK rates about the highest in the world. Now, whenever we talk about an allergic reaction, the hormone histamine plays a big role. But here's the thing. Most of us have heard of antihistamines or even stock up on them when hay fever season's approaching, but we don't actually know what histamine is. Firstly, if histamine is that disruptive, why do we have such a pesky chemical in our body in the first place? Well, histamine is usually our friend. It's a hormone, which means it's a signaling molecule sending messages between cells. And a lot of what it does is actually good for us. For instance, it tells stomach cells to make stomach acid. It helps our brain stay awake. That's why they sometimes mention those possible side effects with the antihistamines, because some antihistamines can make us sleepy, and other antihistamines are used to treat acid reflux, precisely because they are interfering with the histamine in our system. But histamine also works with our immune system. It helps protect us from foreign invaders. When the immune system discovers an invader, it sends out antibodies and responds to that invader by spewing out histamine and other inflammatory chemicals from the mast cells. Histamine causes the blood vessels to become more permeable so that white blood cells and other protective substances can sneak through and fight the invader. Histamine's actions are great for protecting the body against parasites, but with allergies, the immune system overreacts to harmless substances, not parasites. And this is when histamine becomes a problem, especially when it's running riot because we've encountered some peanuts, pollen, or animal fluff. Leaky vessels cause the eyes to tear up, congestion in the nose, and swelling basically anywhere. Histamine also works with nerves to produce itching. With food allergies, it can cause vomiting and diarrhea, and it constricts muscles in the lungs, making it harder to breathe. All these symptoms can vary greatly in severity, and the most worrisome one is obviously when histamine causes anaphylaxis, a severe reaction that's potentially fatal. The swollen airways can prevent breathing, and a rapid drop in blood pressure could starve organs of vital blood. These are the main symptoms of allergy, and this is what we're seeing in the park right now as spring and pollen allergies start to take hold. So firstly, how do we diagnose an allergy? Well, we would take a medical history. You might have a physical examination, a skin prick test, and even a blood test looking for IgE antibodies. Diagnosing allergies typically involves a combination of reviewing your medical history, conducting a physical exam, and performing some of these specific tests to identify allergens. Once you have the diagnosis, what is the usual medical advice to manage these allergies? Well, effective management often requires a multifaceted approach, including avoidance of the known allergens, medication, and in some cases, immunotherapy. These medications can include antihistamines, decongestants, corticosteroids, allergy shots for the immunotherapy, and of course there's emergency treatment, which is the EpiPen, when you need that. So do these medications actually work? Well, they each play a different role in managing allergic reactions. They can be used alone or in combination, depending on the severity of your symptoms. So antihistamines block the receptors to histamine to reduce the symptoms. Decongestants will relieve nasal congestion. Corticosteroids reduce inflammation. Leukotriene inhibitors will block the chemicals that cause the antihistamines. So antihistamines, that cause the inflammation. Medicines like steroids can calm the inflammatory effects of allergies, and anaphylaxis needs to be treated with a shot of epinephrine, that's the EpiPen, which opens up the airways and increases the blood pressure. On top of that, you may be advised some lifestyle and home adjustments which can help reduce your exposure to the allergens and help manage your symptoms. These are things like keeping the windows closed during high pollen seasons, using an air purifier, regular cleaning to reduce dust mites and pet dander, and using hypoallergenic bedding. But as always, with functional medicine, we want to know if there's more than just sticking plasters over the symptoms. So is there actually anything we can do about seasonal allergies? Luckily, yes. And there's a three-pronged approach that we usually take. Firstly, we work on, guess what? The gut. I know this is anecdotal, but I found time and time again with my clients that working on their gut, strengthening the barrier and also the microbiome can massively improve hay fever and allergy symptoms. But it does take time. More immediately, and this is the second prong, there are supplements such as quercetin, vitamin C and D, probiotics, omega-3 that can help, as well as foods such as a local honey, nettles, garlic and green tea. These are all listed in my blogs about hay fever. Finally, there's things like acupuncture and using barriers around the nose and some essential oils. I'm not going to go into detail here because I want to get back to histamine. When someone has hay fever, the histamine's already there in the body to be released, but you can suffer from the same symptoms when you have something called histamine intolerance. And a lot of people don't usually realize that this could be their problem. Excess histamine is usually broken down by enzymes in the body. However, histamine intolerance, also called histamine insensitivity, is a condition where an individual cannot break down histamine quickly or efficiently enough, resulting in them having more histamine in their body than is required for normal functions. And this excess can result in very distressing symptoms. Now, when a food has an excessively high histamine content, even healthy individuals can have a histamine intoxication. There's something called scombroid fish poisoning, which is an example of this. Then for individuals with histamine intolerance, even consuming foods with normal histamine content can cause histamine-mediated symptoms. So histamine intolerance, it's a pathological condition in which the enzymes that usually degrade the histamine are inhibited, so they're insufficient to inactivate the histamine from food and to prevent its passage into the bloodstream. Diagnosis is difficult because an excessive accumulation of histamine in the body leads to miscellaneous symptoms depending on where in the body that histamine has bonded to receptors. So lots of non-specific clinical symptoms provoked by certain kinds of foods, drinks and drugs are often attributed to different diseases such as allergy and food intolerance, mastocytosis, psychosomatic diseases or adverse drug reactions. Correct diagnosis of histamine intolerance followed by therapy based on a histamine-free diet and supplementation of diamine oxidase can improve the quality of life. So what are the symptoms of histamine excess? Well, when the total body level of histamine exceeds the enzyme's capacity to break it down, there can be a wide variety of unpleasant symptoms, which I've listed here. And you'll notice when you see these that a lot of these are very similar to the symptoms you get from allergies. There's also things like digestive problems, heartburn, indigestion, hypotension, that's a loss in blood pressure, tachycardia, chest pain, all these things. You probably think it's an allergy, but maybe you want to look at histamine as well. Very rarely, but this is serious, there can be a brief loss of consciousness, which usually lasts for only 1 or 2 seconds. Now, not all of these symptoms will occur in any one person, and the severity of symptoms will increase with the levels of histamine that are present in the body. So why does this excessive histamine cause problems? The symptoms only occur when there is an excessive amount of histamine in the body. Excess histamine is usually broken down and removed from the body by enzymes, 2 of them specifically, diamine oxidase, DAO, and to a lesser extent, histamine N-methyltransferase. These work in different tissues and act throughout the body. Now, people with low levels of these enzymes have a significantly lower threshold level of histamine tolerance than the normal population. And the two enzymes work in different ways. Under normal conditions, when histamine levels from any source rise above a certain level, these enzymes rapidly degrade the excess. But when the rate of breakdown is insufficient to deal with the excess, the total level of histamine in the body rises. And at a certain critical level, signs and symptoms occur. These are the result of the histamine coupling with the histamine receptors on specific cells, producing a clinical picture that is often indistinguishable from allergy. Now, let's talk about the microorganisms in the large bowel. I'm always going to go to the gut first. A number of the resident bacteria in the human bowel produce histidine decarboxylase and can convert this histidine as it enters the bowel into histamine. So the more microorganisms that produce that enzyme in the colon, and the greater the amount of protein material that enters the bowel, the higher the level of histamine in the digestive tract. From here, this can be transported through the bowel wall to various sites in the body. Now, we have no way of selectively removing these microorganisms, but it is something to remember. When the immune system is activated in response to foreign material entering the body, histamine is the first mediator released in the process that causes inflammation. Now, there are 4 different histamine receptors in the body, H1 to 4, numbered in the order in which they were discovered, and each has a very specific role in histamine function. So H1 is found in neurons of the brain and the nervous system, smooth muscle cells, the airways, epithelial cells in the digestive tract and the skin, the liver, loads of places. When excess histamine interacts with the H1 receptor, symptoms will include redness, itching, swelling, rhinitis, rhinorrhea, bronchoconstriction, and maybe urticaria. So we can block these with typical antihistamines, referred to as H1 receptor antagonists. These are things like Benadryl, Claritin, Zyrtec, and Reactine. And these prevent the histamine from reaching the cell and so can reduce and eliminate the symptoms. H2 receptors are found in cells in the brain, stomach, some of the other places. Both H1 and H2 receptors can degranulate mast cells, which induces the production of antibodies and cytokines and can increase the liability of this cytostorm and increase in inflammation. H2 receptors in the stomach are particularly important because histamine coupling to those receptors results in the release of gastric acid, which is essential in digestive function as it initiates the breakdown of proteins in the diet. But an excess of that gastric acid can result in gastritis with symptoms like reflux and heartburn. So that's often a mistake that people make. It's a histamine result, it's a histamine cause, but it's an acid result. Those receptors are also important in the regulation of gastrointestinal motility as well. So sometimes you see changes in constipation, diarrhea, that sort of thing, because there's an excess of histamine. H3 receptors are particularly important in the brain and the nervous system. In this situation, histamine can affect the sleep-wake cycle, cognition, thought, reasoning, regulation of energy, and again, inflammation. And then H4 receptors are the most recently discovered histamine receptors, and they're found on a wide variety of different types of cells in the body, pretty much all over the place, and the full range of its properties is yet to be determined. So excess histamine in the body can cause a wide range of symptoms, resulting from increasing the permeability of the cell membranes to facilitate movement of what's inside the cell into the surrounding tissues. This is where the histamine gets out, causes things like swelling in the nose, everywhere throughout the body. In the tiny ear canals, this edema can lead to pain in the earache, also typical for an allergy. And then there's something called pruritus, which can become particularly uncomfortable for sufferers of histamine intolerance as histamine levels rise in any part of the body. So I spoke about the 2 major enzyme pathways that degrade the histamine. Once histamine has been degraded, it is usually excreted by the kidneys through the urine. I'm going to talk mostly about the one diamine oxidase. When DAO is sufficient and functioning properly, most of the histamine that comes in from the outside, mainly from components of the diet, is broken down in the digestive tract and removed before it can enter the body. But when DAO is deficient, much more histamine enters the body and starts building up inside it. Symptoms from that will result when the levels of histamine exceed a person's limit of tolerance. Now, there can be several reasons for histamine to increase, and one of those is actually genetic. A lot of people don't have the genes, or the genes are switched off, that would normally make that DAO enzyme. This is something you can actually test with a genetic test. The other enzyme as well, you can see if both of them, if you are a slow producer of that enzyme, it's something you're going to have for life. So apart from the genetic reasons, what are the other factors that might increase histamine inside the body? Well, there are several conditions and also good old hormonal changes that can affect histamine levels within the body. First one of those is going to be allergy. Histamine is released from the mast cells in large quantities during an IgE antibody-mediated allergy. So whenever a person is experiencing an allergic reaction, the level of histamine in their bodies becomes excessive. This can occur in many sites within the body and can be triggered by a wide range of different allergens that we spoke about earlier. Also, you can have a reaction to medications and medical test reagents. But people often experience an increase in their histamine-related symptoms during the season in which their pollen allergens are triggering hay fever, or whenever they come into contact with or consume material to which they are allergic. So you might have an underlying histamine intolerance, which really comes out in hay fever season. Then there's inflammation. Histamine always involved in inflammation. So increased histamine may be a result of either an acute or chronic inflammatory response in the body. So maybe there's a trauma, an infection, or inflammation within organ systems when you've got something like ulcerative colitis, inflammatory bowel disease, something like that going on, which is going to mean that the level of histamine is increased because of that inflammation. And then if you've got the histamine intolerance or the reduced enzymes, you're not getting rid of it. Then there are things called mast cell activation disorders, which is when excessive numbers of mast cells accumulate in various tissues, which is where the inflammatory mediators, including histamine, are stored. When the cells degranulate in response to immune activation, the histamine and other inflammatory mediators are released in overwhelming amounts. And when this happens, the sufferer experiences all the symptoms of histamine excess. The vast majority of people with mast cell activation disorders will not get a positive reaction to routine allergy tests, but they are likely to show an exaggerated response to the histamine applied as a positive control in an allergy skin test. So that can be a good way to diagnose it. Then there's hormone changes. Histamine levels can be affected by hormone changes. In women, this particularly occurs around puberty, during certain phases of the menstrual cycle, and also, of course, in menopause. Interestingly, during pregnancy, the placenta makes a large amount of DAO enzyme, and women often find their symptoms are completely relieved during pregnancy. But unfortunately, it's only temporary, and the sensitivity usually returns after the child is born and the placenta is no longer functioning and available. Men can experience lowered testosterone and progesterone and increased estrogen as they age. Increases in the estrogen production in men result from normal aging, but also from a high degree of body fat, hormone replacement therapy or medications, nutritional deficiencies, or excessive alcohol use. Furthermore, some testosterone may be converted to estrogen due to the activity of an enzyme called aromatase, which increases the estrogen levels further. Some changes may, in this case, influence the immune response, histamine release and control, and lead to an increase in levels and the onset of symptoms of histamine excess or intolerance. We need a lot more research into these effects before we can understand how hormones interact with the immune system in triggering these adverse responses, and also allow us to design appropriate management strategies. We have a long way to go. I did mention before there are certain microorganisms in the bowel that produce the enzyme that produces histamine from histidine. So people with large numbers of these microorganisms are more likely to experience histamine-related symptoms. Finally, medical agents and medicines. There are some agents used in medical treatments or tests, certain drugs, radiographic dyes, some agents used in anesthesia. These can raise histamine levels in the body as well. Some medications release histamine themselves, and others can reduce the effectiveness of DAO. So this means that even people who have never been sensitive to histamine in the past can suffer symptoms. So an increasing number of researchers are investigating drugs and other medications for their potential to liberate histamine or decrease the effectiveness of those enzymes. So if you're taking any medication at all, you should carefully check the ingredients to see if it contains any agents that interfere with histamine metabolism. You can find lists of these on the internet, and if anyone is interested, please get in touch with me. The most important source of histamine that we get into the body is from diet. Some foods and drinks are naturally high in histamine, sometimes as a result of the ripening processes in certain fruits and vegetables. Others contain histamine as a result of their manufacture, especially if there's fermentation by microorganisms as part of the process. Inadequate precautions in food handling and storing of food can also introduce microorganisms with the capacity to convert that histidine to histamine, and thus again introduce excess histamine into a food that would not normally contain it. Certain foods do seem to contain high levels of histamine, and some preliminary research studies have indicated that histamine may be produced during the ripening of some plant foods, such as tomatoes. Green tomatoes contain virtually no histamine and can be eaten on a histamine-restricted diet, whereas red tomatoes contain a significant amount of histamine and must be avoided. For myself, I've always had an issue when I'm peeling and chopping red tomatoes. If I get them on the skin, I always get a bit itchy. I have to wash my hands straight away. Not the same with green tomatoes. So it's possible that other fruits go through a similar process and produce histamine in the course of ripening. Ripe red cherries, for example, contain more histamine than the unripe fruit. And similarly, overripe and rotting vegetation will be high in histamine. Many reactions to fish and shellfish, interestingly, have been blamed on allergies, when in reality it was a reaction to an exceedingly high level of histamine in a fish that maybe hasn't been processed correctly. The gut of fish contains bacteria that produce that enzyme histidine decarboxylase. So while the live fish do not contain histamine, as soon as a fish dies, the gut bacteria start to break down the tissue proteins, which releases histidine that is rapidly converted to histamine. Since bacteria multiply extremely quickly, the level of histamine in the ungutted fish can double every 20 minutes. So the longer the delay in gutting a fish, the higher the level of histamine in its tissues. In addition to that, shellfish, which are not gutted after harvesting, bacteria in their gut will keep producing histamine until they're cooked. Manufactured foods. There are a number of food manufacturing processes that depend on the production of amines and similar chemicals for the flavor and nature of the food. Any process that requires microbial fermentation will result in the production of relatively high levels of amines, including histamine. Some of the foods that do contain substantial amounts of histamine include cheese, especially types produced by microbial activity. So cheese produced by curdling without microorganisms such as paneer and some types of ricotta do not contain histamine, but cheeses that are fermented definitely will. Alcohol, alcoholic beverages, and non-alkalized beverages made by fermentation, such as alcohol-free beer. It's all about fermentation. So things like vinegar, fermented vegetables such as sauerkraut, kimchi, then there's fermented soy products such as soy sauce and miso. Then there's processed meats, beg your pardon, pepperoni, bologna, salami, frankfurters again. There is a full list of all foods to avoid in the histamine restricted diet, which you can find on my website. Then there's another mode of histamine release associated with food matter, which is suggested by research into the mechanisms of intolerance associated with food additives. Now, food additives in general are not a good thing, but azo food dyes, which are nitrogen containing, such as tartrazine, and preservatives such as benzoates and sulfites, have been suggested to release histamine by as yet processes we're not completely sure about. Clinical experiments have demonstrated that people sensitive to these chemicals experience an increase in histamine in their blood levels that remains elevated after histamine levels in a non-reactive person have returned to normal. Now, some foods contain natural sources of these chemicals, such as benzoates, and these may also release histamine when they're consumed. Berries, strawberries, raspberries, cranberries, some vegetables like pumpkin and aubergine, some herbs and spices, particularly cinnamon, and green and black tea, can contain significant levels of benzoates, and this can contribute to the level of histamine in the body. Traditionally, certain foods have been said to be histamine releasing because ingestion of the food tends to result in symptoms of histamine. Egg white, thought to be histamine releasing, quite apart from being an allergen, although it's not known how egg white releases histamine. Then there's strawberries, raspberries, and shellfish, which were previously similarly designated as histamine liberators, but more recent research has uncovered evidence of physiological and biochemical processes as the origin of histamine from these foods. Diet can be extremely helpful in reducing excess histamine, and I've written separately in a couple of blogs about the histamine restricted diet, which explains it in detail. It is important to understand it's necessary to avoid all histamine associated foods, that's histamine containing and histamine releasing foods and additives, in order to reduce the histamine below a person's level of tolerance. So the best thing to do if you want to try this is to see if you have any symptom relief after a trial of at least 2 weeks on the histamine restricted diet. Provided that the issue is an excess of histamine rather than an allergy to it, diamine oxidase, DAO supplements may be helpful when dietary restrictions alone are insufficient in managing symptoms. However, it's important to understand that DAO in the supplement is not absorbed into the body and therefore will not increase the amount of DAO you have within it. It just stays in the gastrointestinal tract. Most dietary supplements, such as vitamins and minerals, enter the body and increase the availability of those agents in the body. But DAO supplements cannot do that. It will only reduce the amount of histamine in the food by enzymatic breakdown as it passes through the digestive tract. So therefore, the amount of dietary source histamine entering the body is reduced, which may allow the patient's total level of histamine to remain below their limit of tolerance, providing some symptomatic relief. Other supplements we talk about a lot are quercetin, which can help with both allergies and histamine. Then there's probiotics. So we know that certain strains of microorganisms actually produce this histidine decarboxylase, which is the enzyme that converts histidine into histamine. Now, when those strains are part of the microflora of the bowel, they're able to convert that histidine in undigested food into histamine that is absorbed into the body, increasing the person's total histamine level. So you have to be a little bit careful when you're taking probiotics, because if you've got the strain that is going to increase that enzyme, it's a problem. However, some other microorganisms produce diamine oxidase, and they might have the ability to break down the histamine in the digestive tract, helping to reduce the total body level of histamine. Again, we don't currently have a way of delivering these specific microorganisms to the digestive tract in the form of probiotics. So it's something you might want to experiment with, because if you're indiscriminately taking a probiotic as a treatment, you actually carry the risk of increasing histamine if one of more of those probiotic strains produces histamine from histidine. So it's unwise to take a probiotic in an attempt to manage histamine intolerance or sensitivity without being aware of that fact. Vitamin C can be powerful. It has anti-histamine properties if histamine intolerance is a result of DAO deficiency alone. Vitamin C, while vitamin C does have antihistamine properties, if that histamine intolerance is a result of DAO deficiency, there is some evidence that vitamin C might reduce DAO activity slightly under some conditions. So there might be a contraindication to consuming high levels of vitamin C when it's the DAO deficiency which is the cause of your histamine intolerance. Then there's also zeolites. These are the clays which have had a lot of success in reducing the amount of histamine in the gastrointestinal tract. Again, a bit like the DAO supplements I was talking about earlier. When you take these zeolites, they go into the gastrointestinal tract. They don't go through the gut wall into the blood system, and they clear out the excess histamine. So these can be immensely helpful. A histamine restricted diet is what I talk about in my blogs. And this can be very, very helpful. So what is the conclusion of all this? Basically, the first thing you need to know is whether you've got an allergy or whether you're suffering from histamine intolerance because of histamine excess. My advice, and I continue this in my blogs, is to work on the assumption that you've got an allergy first. And if that's what you want to help, then you're looking at strengthening the gut, taking certain supplements, and using certain foods to help with that condition. If, however, you suspect there is a histamine intolerance, then that's a different approach. The histamine restricted diet is actually quite restricted. So I don't encourage people to do that on their own without the support of a nutritionist or professional. And we are absolutely happy to provide that. So if you think either allergies, hay fever, intolerance, histamine intolerance, anything like that is an issue, please get in touch. We'd be delighted to have a complimentary 20-minute call and go through these issues with you. And then if we can help, put you on a program where we guide you through all the testing, all the diet, all the supplements, and hopefully help with your symptoms. Head over to the website for any more information. Please get in touch if you have any questions. I will be doing a Q&A session after this. So if anything comes up, email it to me and we'll sort it out in the Q&A session soon. Thank you so much for staying with me.